Okay, my name is Heun. I'm a consultant psychiatrist and I am editor of Global Psychiatry Archives. And today I'd like to talk about abnormal beliefs, delusions, and overvalued ideas. Usually it's very important that we examine the patient's ideas and beliefs, and this is part and parcel of the mental state examination. Usually, abnormal beliefs or false beliefs include primary and secondary delusions or overvalued ideas. Usually, people with delusion might have what we call, or common people would call, madness. Delusions are symptoms of major psychosis or severe depression. So what's a delusion? It's a pathological belief which has several characteristics. It's held with absolute subjective certainty and cannot be rationalized away. So something like the delusions of a wife's or husband's infidelity. The patient might be completely convinced about that, but it can't be proven and can't be disproven. And the belief is held with absolute certainty. It doesn't require any external proof and may be even held in the face of contradictory evidence. Or sometimes there is no chance there is any contradictory evidence and the delusion cannot be proven. It has usually and must have a personal significance, and it is important to the individual concerned. It's not a belief which can be understood as part of the cultural or religious background. So if people believe that Jesus will come back, or that there's a God, there's a devil, and there are specific gods, that's not part of a delusion because it's cultural appropriate in a specific religious background. So usually or sometimes the delusions might be bizarre or false, and that might not be always the case. Sometimes they're less bizarre, or they refer to guilt, years old guilt, and that something might follow out of this guilt, or people might have the delusion if they do something or don't do something, that something bad might happen to the family. So let's say if they steal something, if they don't listen to anybody, if they're nasty to other people, something nasty might happen to the family. So that might be a delusion. A secondary delusion is when it's part of a depression. So the depression is there and the guilt goes with the depression. So that's a secondary delusion. A primary delusion doesn't have any independent pathological process. It's not part of another mental health disorder, but usually delusions are categorized according to their content, depending on external factors or interpersonal relationships. Contrast to delusions, they're overvalued ideas. They're usually non-delusional, non-obsessional, abnormal beliefs. So the belief itself or the might be acceptable or comprehensible, but people might be preoccupied permanently about that, and sometimes it dominates their thinking and behavior. This might be, let's say, the idea that someone is ugly or someone is poor, or some other people might not like him. That might be true or not true, but the problem is that the belief or the idea might have some truth in it, but the problem is that the person cannot think about anything else. So this happens in body dysmorphia, where people think that they're ugly, everybody knows they're ugly, and they might have some physical flaws in the normal sense of other people, but that's something, if it's very consuming the patient's thinking, we can see this as an overvalued ideas. It usually can become part of other disorders, body dysmorphic disorder or dysmorphia, It can cover the weight or body shape that happens in anorexia nervosa. It can affect the personal rights in people who are very paranoid, and sometimes it can also affect other people who then think that our word is going down or the globe is going down as part of the environmental pollution. Sometimes it's certainly true, but if people can't think anything else, then it's an overvalued idea, even though it's completely true or might be true sooner or later. But the fact is that people sometimes cannot think anything else but about something, and they might neglect other parts of their life. So that's for today. Thanks for listening. And if you are interested in any of this mental health explained, please look into our specific YouTube channel. And if you like it, please tick the right button and recommend it to your friends and family if you're interested in. Thanks a lot and have a good evening.